Well, hey there, everyone. It's Kristi, and welcome to the second hangout of this month. And I just remembered I was supposed to organize the fundraiser, and I didn't. So I suck. I'll have to do a video on
Next
that where you
month.
guys, yeah. But I did make the contribution to the Heather Heyer fund, and as I said, it was down to 15 because people had the adpocalypse and other more needy creators. So just to let you know, and I don't have that prepped either. But while people are talking, if I remember, but yeah, 15 out of the PayPal went to the Heather Heyer Foundation for Social Justice and teaching topics on social justice or people who wanted to get involved in making their communities better. So thanks everyone who contributes to my Patreon, including the people in the Hangout, for making that possible. Now, we are having a really great hangout, in my opinion. One, because I really enjoy talking to you guys. But two, I don't have to do a lot of talking because we have people who are experts, or at least they have firsthand experience in a topic, and I can just listen. And also, I should say to the rest of the people in the Hangout, if you do have questions, maybe pop them in the chat, and if people can turn their chats on, and then maybe when people get to the end of their presentations, or if you see a question pop up, you can call on people and then take some questions if they have any. So we're going to have a nerdy hangout, which is on the way that different countries handle their healthcare systems. In the United States, healthcare is a big topic because it's a very cumbersome private process, but there's also government programs and government subsidies, so it all gets very complicated. And other countries have other ways of organizing the way they deliver healthcare. Tonight, we're going to hear, I think, from 3 of those, and then we'll talk about those 3 in comparison with the United States. We'll leave the U.S. till last. You know, U.S. always gets all the attention. Tonight, you're going to sit back and listen, and then we'll talk about the implications for other countries and what it would look like in the U.S. And the first person we're going to have up is Mariana, who's going to talk about the German healthcare system. That's the one I currently enjoy. Then we're also going to have Leto, and she's going to talk about the French healthcare system. We have also, and I have to say, Marius might be talking about healthcare in Poland. I can speak a bit to the healthcare system in the UK because I was a user of the NHS for 8.5 years. And then we'll wrap it up by comparing how these countries have organized their systems and what that would look like would the ways that other countries have set it up be possible in the US based on the opinions of people in the room. We're not experts. We're just having a good time and an interesting chat. So yeah, I'm going to let it hand it over. Mariana, please tell us, and assume that we know nothing. Assume we're like children on this issue.
All right, then. The German healthcare system, well, the insurance system, is the oldest in the world. It was started in, the law was signed into, verabschiedet. Well, the law was decided in 1883, and it became functional in 1884. And well, it's 2-tiered. You have the gesetzliche, the lawful, the mandatory part, and you have a private system. Insurance in Germany is mandatory. You have to have it. Private insurance companies now have to provide a tariff that covers everything that the non-private stuff does, and they have to take people. They can't in this tariff. They can't send them away. No, you're sick. We're not going to insure you. In the non-private, it's Krankenkasse, gesetzliche, lawful, thing. Yeah, I'm not firing on all cylinders today.
That's okay. You're doing a fantastic job.
Anyway, everyone pays the same percentage of their wages into the system, and the amount is matched more or less by the employer.
Yeah, mine is under around 300 euros a month, which would work out to under $400 per month that I contribute toward my insurance plan, for instance.
Yes, I'm. Well, there's a cap because if you earn enough in a year, you can decide: do I want to stay in the social pool or do I want to go private? For instance, I earn enough that I could decide to go private, but I stay in the social pool because it's cheaper in the long run. And I think my monthly payment is something like 450 euros, and that's the maximum you can pay. It doesn't go any higher. And so, what and who is covered? If you have dependent children, they are covered at no extra cost until they are 26. If you have a stay-at-home spouse, that's who's taking care of the children or something, they are covered at no extra cost. So everyone pays the same, and it doesn't matter how many dependents you have, they are covered at no extra cost. And you don't have to get a health check before you join because, well, it's mandatory. They have to take you. And there's only few exceptions for whom health insurance is mandatory. The self-employed, for them, it's not mandatory. If you earn enough that you can choose to go private, you don't have to join that. And civil servants, the sworn-in kind, they have private health insurance. It's a bit of a problem for them because they can't leave the private insurance, because if you have left the social system and gone private, and then suddenly you find, oh, okay, I'm getting older, the premiums get higher and higher. Oh, I want to go back to the social system. You can't. Well, you can, but you have to back pay everything that you didn't pay when you left. Coverage, children get glasses. Adults, I think you get a very base model again. That's changed a year or two ago, but only the very basic. So the cheapest frame and the cheapest lenses, which for someone like me who is very nearsighted would be ashtrays. And so
You and me both, sister.
yes. But there are many opticians and chain opticians in Germany who do decent frames and decent lenses at reasonable prices. If you're on Social Security, that's not enough, but most people who need glasses can get them. And for dental stuff, the cheapest option is covered. So if you lose teeth, you get dentures, the cheapest kind, or if you have a cavity, you get the cheapest type of filling, which is some kind of plastic composite stuff. It's fine. And but more complicated stuff like implants and the like is not covered. And you only get dental replacement if you can prove that you have been going to the dentist regularly for the last 5 or 10 years, I think, to show that you have that you took care of your teeth properly and that the dental loss couldn't be avoided. So hospital stays are mostly covered. You have to pay a day fee that's kept at 6 weeks, I think, and it's something like 10 or 14, 15 euros a day. I paid this earlier this year because I was hospitalized for a bit. And yes, the next most important thing that the insurance, the social insurance covers is long-term sick leave. In Germany, you get full pay for 6 weeks when you're sick. After that, you get 70% paid by your insurance, which is enough to get by. And then once you are well enough to go back to work, and if you have been sick longer than 6 weeks, you have the option of a gradual reintroduction to work, where you start with, say, 2 hours a day for 2 weeks, then go to 4 hours, 6 hours until you reach your full hours. Until during that time, you still get the sick pay from your insurance at 70%. I did that too this year because I was off for 4 months and followed by 6 weeks gradual reintroduction. And yeah. So what else?
I have a question if you're looking, Mariana, which is, my understanding, and you can correct this if it's incorrect, because I was told this, so it's like word of mouth. But so everybody has insurance, except for, like you said, some people who are self-employed or special cases. But otherwise,
Yes.
everyone's paying into the system. And the other thing too that's I think important for Americans, it will sound really strange, is that every doctor accepts every form of insurance, because it's everyone has to have it. The other thing as well is, it seems like what happens, and things cost the same. Tests
Yes.
vary in their prices, and there's some sort of meeting where doctors and insurance people and the government come together, and they basically know like how many heart attacks there were in Germany last year and how many people needed insulin and for what amount, and they figure out, basically they kind of project ahead in terms of what the health needs are going to be based on last year and maybe some other things, and then figure out what the costs are in order to make sure people get paid and make money and the system keeps working. And then those costs are agreed by the doctors and the insurance companies. And that is how things cost the same across the country. And also, you get then why doctors would be willing to accept every insurance form or insurance company card that's presented, because they're going to get paid no matter who the patient is.
So almost all doctors accept all kinds of insurance, with very, very few exceptions, and those are really, really, really few that only take private insurance. But they are the kind of doctors, the stars and so on go to. So not regular people. And so the price of stuff, there's a catalog, so to speak. The
You can like pick up a catalog and find out how much an like getting your appendix out costs, for instance.
Probably you could find that out somewhere on the internet, because I'm sure someone has posted it.
Yeah. So here's how much it is for broken arm. Here's how much it is for appendicitis. Here's how much it is to have your tonsils out. All that kind of, just look up the cost. Boop, there it is.
Yeah, basically. And so to get covered by insurance, a treatment has to, one, work, and two, be cost effective.
This is so practical in German, the way that it's all laid out.
So top of the line experimental treatment can't get, but the tried and true stuff that's become standard of care, that's covered.
All right, that's great. So does anyone have any questions for Mariana in terms of the system? If you guys want to speak up now. I don't know if anyone does. No, everyone's all right? Okay. So so that's an overview. We could probably have a wider discussion at the end, but yeah, maybe we can move on to the French system now, if you're ready to go. And Mariana, that was really helpful. And I think a lot of Americans are going to be like, I can't, what? Like, it's a really great system. I prefer it to the NHS, if I'm honest. But I can talk more about that in the discussion time. So thanks for that. That was really great. So yeah, are you ready to go, Lido?
Yeah.
All right, let's hear. Yeah, let's hear about the French system.
Okay, so it's a lot similar to what Marianne just described. So everyone has a right to health insurance. So everyone pays it if you can, because obviously if you're unemployed or retired or whatever, because it's taken directly on the on your pay, on your salary. So you don't pay it. Basically, it's taken. You don't have to worry about it, and it's about I'd say 20%, I think, and yeah, and so it covers only some a part of medical cost, not the totality. So in France, you have to have some kind of private insurance with the social security one, which is okay because it's not as expensive as in the US, if I understand correctly, how the price of stuff there. For example, my partner and I pay €60 a month for both of us. And it covers the teeth very well, the glasses very well, pretty much anything very well, to be honest, which the, like what Marianne was saying, the stuff in for the, I'm sorry, I'm really struggling with my words. Okay. Focus.
Yeah, it's not a problem at all. You're doing this in a second language. Everyone is, I'm always impressed with people who hold conversations.
Yeah, but it's a pain in the ass to listen to, so I'm trying to be a little more fluid.
Don't put pressure on yourself, but yes, please continue.
I prefer thinking more about my sentences before and have more fluid sentences than thinking while I
know.
speak.
I know what you mean. Yeah.
Anyway, so what was I saying? Yeah, glasses and teeth are really, really badly covered by Social Security. But anything that's basic, general practitioner, basic teeth care, psychiatry, anything that someone needs to survive and live a decent life. It's only true when you're able, but obviously I'd like to add some stuff at the end about when you are disabled, how it works. But in general, it's pretty good. You don't die from being poor. You have access to decent healthcare, but you have to pay. You are reimbursed by Social Security and your private insurance, but you have to pay. Option is when you are when your income is below a certain amount, you have a right to what we call universal coverage, which can replace your private insurance and looks and sounds a lot like what Mariana was describing, with the basic stuff for the eyes and the teeth, but it works. I actually I'm going to go back to the universal coverage, because my partner's workplace is going to change providers, and it's going to be more expensive than what we are paying right now, and it the right to universal coverage, so totally free. So I'm going to go back there. We can't really afford to go $20 more than what we are paying right now. So there's that, and you don't have to advance the payments. It is paid for by Social Security directly. Okay, and what I want to say, I don't know if it's the same in Germany, but Social Security isn't the state. It is partly financed by the state, and the rest is financed by us, the people who pay for it. Okay, it's not a governmental agency. It's private, actually. A lot of people don't realize that, but it's not a public service thing. So there's that. Because I hear a lot of Americans saying that they don't want the government in healthcare and whatever. It's not the government. You can have a private entity that, but as it's partially financed by the government, they have to respect some rules, which they have to pay people insurance. They have to commit to what they say they will. They did so.
Right. So it's a kind of public-private mix in a way.
Yeah, it's private and the public mix, and it works pretty well. There are some problems, mostly for disabled folks. With the current French administration, they are trying to take some stuff away. Like last year, they voted for the people not needing to pay upfront, and after being reimbursed, they voted for that to be over, and so the medical practitioners be paid directly by Social Security. Right. But the current administration scratched that recently, so it's gone.
Oh, well, that seems silly, because you're putting another layer in of delay and messing up the money. But whatever. I guess.
Not really, because we have a little card that we call Carte Vitale. And it's an electronic card, and you give that to your doctor, and all the what was paperwork work before is directly sent to Social Security. So there's not a lot of delays for reimbursement, and it's sent directly to private insurances too.
But if you don't have the money to pay for it, you might have to delay it, or, you know.
Oh yeah, if you don't have the money to pay for it, you're in the shit. Totally.
Yeah.
That being said, a lot of general practitioners know that and accept to be paid by Social Security. It's a lot of paperwork for them, as it's not implemented in the system. So they don't want to do it because, well, I get it. They didn't become doctors to do paperwork 2 hours a day.
Right. Well, you think that they would, they have electronic transfers now, you know, so they could just like send an electronic invoice to the
No, because that's more
company
complicated for that kind of. It's kind of a shit show when you are a medical practitioner. Oh. One of my physiotherapists tried to explain it to me, but to be honest, I didn't get it. There's a lot of
so basically you patients are like, so like the state pays part and the insurance pays part, but the doctors say, I'll just deal with you as the patient, and then you go fetch money from 2 people. I don't want to fetch money from 2 people. That's how it sounds to me.
Yeah, but it's simple to us. We are the clients for the Social Security and for the private insurance. So we don't have to do anything. We just have to give our cards and we are reimbursed. It's directly on our bank account. So it's not a bother for us. Apparently, they have to do a whole lot to be able to be paid. It's ridiculous. It should be as simple as for us.
Yeah, would say. Right. Well, thanks for that. That was an interesting summary, and I learned a lot. I didn't know that much about the French system, so that's particularly interesting to me. Did you have more? Sorry, I didn't want to cut you off.
No, unless I'd like to talk about disability a little, but maybe at the end when we have talked about the other systems, because I'm really interested in hearing what the others have to say. And if we have time, I will talk about it. And if we haven't time, I'd rather everyone can talk.
Okay, please interfere, like please insert it into a conversation. If it seems to be drifting off, you go, hey guys, let's talk about disabilities.
Yeah, don't worry, I will.
Okay, good. Right.
But I really want to hear what Marius has to say, and I really want to hear the explanations about the American system, because I really don't get it.
Right, yeah, lots of Americans don't get it either. Marius, are you ready to go? You're muted.
Yes, yes, I think so. First, you have to know that Poland is basically independent from 1989 onward, and our current health system is basically a redesign of the old Soviet-based system. Everybody's insured. If you work, you pay the fee for health insurance. If you're not working and you're registered as unemployed, the National Health Fund covers you. Children are covered under the parents, spouses also. So in theory, everyone's insured. Problem is around 2004, the post-Soviet, supposedly left-wing government started to fiddle around with the health system and screwed it up. They had most of what they done was unconstitutional, so they had to patch it quickly. And nobody really worked on this. Nobody really tried to do any maintenance. Basically, it's falling apart. You have situations like oncological patients having to wait a year for diagnosis. Wait times are ridiculous. People have problems getting even some of the basic health coverage. So most of what happens, you have to go to a private doctor, and they also have, most of them have a contract with the National Health Fund to cover people who want to use their private health company, health coverage company, and they take the money from the government for services rendered. That's basically it. So you are covered, you have most of what's needed to survive. Hospital bills are paid by the National Health Fund. You don't have to pay if you get to a hospital. You don't have to pay for even non-life-threatening situations when you get hospitalized. It's already paid from your taxes mostly, because that's around 9% of your income. And if I remember, 7%, almost 8%. So you pay a little bit over 10% of the overall fee out of your pocket. The rest is taken from your taxes.
Okay. So it sounds like, yeah, go. Sorry, I don't want to.
Yes.
Yeah, dental
and the situation is. I can talk about that. Dental is covered for the most basic things. If you have anything like a root canal, they cover the center 4 teeth. Everything else you pay out of pocket. Basic fillings are available for everyone, but everything else you pay out of pocket. You can get dentures, but there's, as far as I remember, 5-year waiting time for any adjustment or new dentures. So it's basically forcing people to pay it out of pocket for everything they can't wait for.
Right.
So you can have people who have life-threatening conditions, and they have to wait for a year or 2, or even in some cases with specialists, 4 years. Wait time was sometimes reported. So mostly it's pushed back into the private healthcare system. Also, hospitals have a lot of problems because they were partially privatized along the way. So they have to cut costs, and it mostly takes out of patient care and payment and salaries for the doctors. Currently, there's a hunger strike going on for around 3 weeks now. The resident doctors, in Poland, when you get your education, you have to work for over a year as a practice to get even treated as a doctor. And then you're a resident. You're basically bottom of the rung and do everything. They're the workhorses of the Polish health care systems, and most of them earn around 500 euros a month.
What?
Yes. That's about 2,000, 2,200 Polish zlotys. That's basically their, and most of them work for over 40 hours a week. Some of them work for 60, 70 hours a week. There have been, in the last year, 3 or 4 doctors who died of exhaustion from overworking.
That is terrible.
And nobody does anything with it. Our current government is a far right-wing nationalistic government, so they don't care. They're attacking the doctors on strike, trying to paint them as basically greedy bastards who don't want to work, and to the point where the propaganda is really ridiculous. They, for example, took a picture from one of the women doctors who are on strike, and posted it that she's on some exotic vacation somewhere. That picture was taken in the Kurdistan, where she was on a medical mission.
Wow.
So it's that bad. Okay, I think I'm done. If you have any questions, I'm happy to answer it.
That's great, thanks. Well, I think what we can do, I'll skip the NHS because we've heard from 3 different systems, 3 different countries, various things. Thought that the Americans in the room, starting with Matthew and then go to Jonathan and Tom, to talk to their experiences. But we were joined by, all I see is Trump's, I think it says wife. I don't know which country you're from. So if you're not from, well, if you are from the States, you can certainly speak to your experience. But yeah, Trump's wife. I muted you because I could hear your keyboard before. So you might have to unmute yourself. Hey there.
Hi, sorry, it's Tim.
Oh, hi, Tim.
Yeah, this is my my troll account. It's my I play a character on a website called Hat. Sorry, it's the wrong one. That's why the avatar.
I have to say, I've found it really distracting this whole time, and now that it's bigger, it's even more distracting.
I'll turn my camera on. Okay,
nice,
that will get rid of it. I'm just trying to change my profile picture, but anyway.
Yeah, so you're North American?
I'm Canadian.
Yeah, okay, so I don't want to put you on the spot, but do you want to talk a little bit about the Canadian health system? That one might be the one Americans would be most familiar with. And of course, if you don't feel like you have to make stuff up, and if you don't know, just say, don't know or whatever. But yeah, are you pretty happy with the Canadian healthcare system as you've experienced it, and kind of how does it work?
Sure, yeah, I can tell you about it. Actually, a lot of my family actually works in the healthcare system here. My sister's a nurse. Oh. My father works. He's a carpenter at a hospital, and my mother is also a lab. She was a lab tech, but now she's an administrator. Actually, she's at work today doing some kind of work to try to get their computer system back up because it went down over the weekend, and she has to go there on a Sunday when she would normally not be there. But and some of my other relatives are also doctors and nurses and stuff like that. So I guess I can just give you a background on the history. The healthcare system was brought into effect in, I believe it was 1965. It's called the Canada Health Act, also known as just as the Medicare system. So it has a similar name to the U.S. System that if you're 65 or older. And it's a universal system. It's also a single payer system, which I think a lot of people don't realize. They think universal healthcare is automatically it's automatically single payer when it's not. There are different systems within there are different systems within that banner of the universal healthcare, but the Canadian one is a single payer one in that. There are 13 different systems across the country because there's 13 different. There's 10 provinces and 10. There's 10 provinces and 3 territories, and each has their own system.
Right.
That's funded by the provincial governments and then the federal government as well, and. Can you just give me for 1 second? My dog is scratching at the door, and I'll be back.
Yeah, no problem. We all have, go right ahead. What I'll do is I'll kick it over to Matthew because you made a comment about insurance and your employer. So yeah, do you want to talk about your experience with the the employer-based way of doing health insurance that you had in the States?
Well, I feel so inadequate compared to what we just heard about Europe. My healthcare system has always been employer-based. I've had 2 major jobs since high school, and both of them provided insurance for me. So I was always in that system. And the comment I made earlier was, since I've had this current job, we've changed insurance. The company I work for hasn't changed insurance 6 times. And each time I've had to change doctors compared to what we heard earlier about just having, it doesn't matter what you have, you can go to any doctor. That's certainly not the case, at least not around here. because I've had to change doctors, and it's just been a wild ride of different doctors, and never be able to. I've never been able to go back to another doctor I've had before or whatever. I'm in a good place now, and I hope they don't change it again. But with an average of every 2 years, it's been nuts. Beyond that, it's every company, every insurance provider does things so differently. There isn't one system to work with. It's just whatever that provider, whether it's Blue Cross or Concerta or whatever other healthcare provider. I can't even remember the name of the one I have now. It's changed so often. So there isn't any similarity I can speak to that even remotely comes to how knowledgeable Lido and Marianne were about their systems. It's and as I'll shout out someone in the chat, Eric, who said the U.S. system is barbaric, and even though I'm well covered because I've got a good job that provides good benefits, I can see how terrible it is for anyone who isn't in that position.
It's certainly the case that when you have the employer-based system, insurance becomes a business cost. And of course, they're going to shop around to look for better deals, like any customer would in any pool.
Correct.
So definitely, and the other thing with that, of course, is, you narrow the number of people because you're only working with the small people you can get to get into that insurance pool. It's not like everyone's dumped into the same pool. So yeah, it's a pretty messed up system. But yeah, did I cut you off too early? Was there more?
No. You just raised another thought I had. One of the major issues was a few years ago, the company I worked for was acquired. And we had just switched to a different insurance provider, the year before we got acquired.
Oh no, your sound's gone all. Your sound. Can you refresh?
Sorry about that.
Yeah, it's okay. I know how you like your audio. I know how I like my audio. We agree. You're still a little bit fuzzy. Maybe what I'll do is I'll kick it over to some random. Oh, it's coming? All right.
I said I'll fix it after this comment, which is we just switched to an insurance company. We got acquired, switched to their insurance company. Then the following year, they switched to a different insurance company. So we had 3 different insurance companies in 3 years, and I had 3 different doctors every time.
Yeah, and was just quickly, yes or no, was your dental covered by your insurance?
Sometimes yes, sometimes no. As of this last iteration, yes. I do have dental coverage.
And glasses?
Yes. Thankfully, I haven't needed it, but yes, ever since getting acquired, we've gotten a much better insurance.
Get them now, because when you start needing them for reading, once you hit your 40s, you're going to need them.
Oh, and I'm staring down the barrel of 40. It's been good because I do go to the ophthalmologist every 6 months. Luckily, I don't need glasses yet. Still 2030, but we'll see what happens in the next couple of years.
Sounds good. And yeah, your sound is back. Hey, Tim, now that you're not distracted by your adorable dog, do you want to finish your thoughts? Yep, you're still. Oh, yeah.
Sure. Yeah, I let her out. Anyway, she's a little Pomeranian. She's still a puppy. That's why she does it at very inopportune times. Anyway, okay. So, as I was saying, yes, there's basically 13 different systems across the country in the different provinces, and the first one was in 1947 in Saskatchewan by Premier Tommy Douglas, who actually was voted the greatest Canadian of all time for starting the idea of the national healthcare system in Canada. He was voted over people like Wayne Gretzky and our first Prime Minister, just to give you an idea of how he's very revered because we also enjoy the healthcare system so much. Now, in Canada, it covers pretty much all of your medical needs as far as just going to the doctor. Even though most doctors are in private practice, but they charge it to Medicare, so they don't have to charge their clients or the patients. But it doesn't cover any of your dental needs or any like plastic surgery, things like that. So there's a private market for that. Now, there are some people, if you have private insurance, you can go outside the system if you don't want to wait, because we have really bad wait times. That's sort of the downside to our system, at least. Is just for example, I'll use my mother again. She has had two knee operations in the last 2 years, where she had a titanium, I guess, a ball bearing joint put in place of her old one, and she had to wait, I believe it was 2 years to have the first one done, and then another year for the second one. Now, it does take 3 months to heal from that kind of operation, so she would have to wait anyways just to heal up. But as you can see, there is a kind of a chronic problem that we have with that in Canada. That being said, it keeps you from going bankrupt, because there's no one who will ever be denied any health coverage that they need. There's no HMOs in Canada that you have to deal with, and I think it's a pretty good system overall, and we've had it for the majority of the last 50 years now. That being said, we're ranked like the third lowest in the OECD countries, behind France and America. So we have a lot to improve based on that.
Great. Tim.
Yeah,
sorry, I don't want to cut you off if you're wanting to say
I'm just
more.
trying to cover everything I think everyone wants to know. Even if you leave the country, you can still, if you have a health emergency in another country and they don't have free healthcare there, then the Canadian government will pay for it, as long as you maintain your coverage. If you leave the country, let's say you go, for myself, I was in South Korea for a long time. I had to reactivate it when I came back, because I had health insurance there, because I was out of the country for 3 years. I think if you leave for more than 6 months, it depends on the province, but in mine, yeah, it's up to 6 months before it gets turned back on you, basically. So there are some limits to your ability to have it. You know, if you don't live here anymore, then you lose it, basically. So, and if you go to a different province, you have to like register with their health program, even though everybody's covered. That's where the federal part of it comes into place, is that money is basically used for outside. If you're not a resident of that province, then the federal money takes care of that, basically. So, and then there's a federal health minister, and then also there's one for each province, and they meet ever so often to discuss how to better manage it. And there's hardly a politician would ever consider cutting funding to Medicare, because they would vote out instantaneously, because it's so revered by us. So that's basically all I can think of. So I will end it there.
Great. Tim, I am damn impressed. You became a patron today, and came in the link and put you on the spot, and you spoke spontaneously, extemporaneously on the Canadian healthcare system, and gave it a very good summary. So well done. I think applause from all of us if everybody had unmuted themselves at the same time. So thank you. That was I am damn impressed.
Yay, team!
Thank you. But
There is a question from the chat.
Oh, okay.
Does Canada have a private option for supplemental care?
Yes, there are options if you don't want to wait for things. It's sort of like I guess in Poland, how you mentioned that if you want to not wait for something, you can go outside. And I don't think we're trying to force people to do that, though. We're actually trying to cut down wait times. It's a very important issue for people, because like I said, I think we care maybe a little too much about our healthcare system. It gets in the way of other issues sometimes. And yeah, we're still trying to work on that. But I have personal experience, like with my mother. I had to take care of her because with her needs, and it was kind of, I wish they had taken care of it faster than, like the 2.5 years she had to wait for the first one, and then the year 10 months for the other one. So yeah.
Great. I think next up, if you wouldn't mind, some random geek, to talk about your experience with healthcare, and unless you're driving, and can't quite see where you are.
He's driving. I'm going back to GeekCon.
No, I am not driving. I am riding in the car with like the roommates that have had our friends at the car able to with. Sorry about the quality of my audio because I'm on my phone. So I can speak to my personal experience with like healthcare. What's kind of interesting is that like I worked at the same company for about like 5 years and something like that, but we changed coverage, and so there's that. And with that, even if like we switched from Premier Blue Cross over to like Cigna, and so you have that possibility of like if you like that one doctor you were going to, you have the possibility of like, and if you lose that doctor because certain networks their doctors and some of that, and so there's that. And then the other two programs I think are like group health and Blue Shield. That's right. And so if you're and we do get dental, we do get vision and stuff like that, but it's it just like it takes a little bit out of your out of your paycheck and stuff like that. But it is kind of like employer based and stuff like that. And there's also like a Medicare and Medicaid, and I can explain that as best I can. Whereas like Medicare is just like a single payer healthcare system, similar to like other systems. Whereas like, but if you're up there 65, then you get Medicare no matter what, and it's kind of like free is taxpayer or is taxpayer funded and stuff like that. And then there's Medicaid, where it's just for like the poor and disabled people, but like you have to like qualify and stuff like that. And from what I heard before the Affordable Care Act, it was really terrible qualifications, because even if you were like a family of 4 and and make more than like $3,700 a year, I have to go back to the details to know that for sure. You won't get coverage for like Medicaid, so it's a stupid system like that. But that was before the Affordable Care Act. And I think with the Medicaid expansion is like better, but like I don't personally know myself. Like I mentioned in like the group chat before, or the group messenger chats, I had to like watch the YouTube channel Healthcare Triage to learn about my own healthcare system. And
it's
that's
incredibly complicated. Yeah.
But so the Healthcare Triage is just a YouTube channel dedicated exactly to this sort of thing, explaining like even the details and stuff like that. Even like he did, the host Dr. Aaron Carroll did an episode on like the soaring price of the EpiPens and explain why that happened, and that's kind of like important to me because I do have a subscription for EpiPen, and so yeah, and it's kind of complicated. The reason why we pay more on everything yet get worse coverage is John Green explained in a Vlog Brothers video. It's mainly because the government does not aggressively contract for these things and stuff like that. So it is that can like name their prices and stuff like that. And yeah, I think I'll let others talk instead of rambling on more.
Okay, all right. Well, Talam is last up, and yeah, do you want to talk about your experiences in the healthcare system in the States?
Yeah, I've been on Medicare for, well, okay, back up. Medicare does cover people who are over 65, and well, with some, leeway in certain cases, and people who are determined to be disabled according to federal disability standards. I was considered disabled since 97, so I've been on Medicare since then. Medicare covers 80% of what they do cover. They cover 80. And then you cover either the 20% out of your own pocket, or you buy a supplemental health care policy that pays that 20% that Medicare doesn't cover. Medicare does cover a few things, some things, 100%. I believe it's things like diabetes testing supplies and insulin, things like that, where the price might keep people from taking care of their health in ways like with diabetes. If you don't take care of diabetes, it's going to cost a lot more to fix what you could prevent, the damage, to fix damage you could prevent. So they cover 100% a number of things that are in that sort of category. I have not had any, okay, back up again. Most places that I'm familiar with, most healthcare providers will accept what they call Medicare assignment, which means that they will take the price that Medicare is willing to pay for their services. And that means that in most cases that they get a lot less than they would normally get from private health insurance or from private pay. So there is some negotiation, it seems like, in that situation. I've seen I don't get bills, but I get statements that show the cost that's billed, the cost that Medicare pays, and the amount that the provider writes off. And there is significant, so the government has a capacity, I guess, going back to Jonathan's point, the government has a capacity to negotiate if they want to, or to just use the power of their size to, to offer providers something that they have trouble refusing. I have not had any trouble at all getting services. The one thing about the American system is, speaking to Tim and to Marianne and Lido and Marius, the wait times here, in my experience, have been very low, relatively low. I haven't had to wait. But I also live in a rural area that has a lot of hospitals and providers in the area. So it may be a function of that, of the population to provider ratio as well for my situation. I don't see bills. I mean, I get statements about what things cost and what was covered, but I don't get a bill for things from Medicare. Now, I'm also on Medicaid, and that's because of my disability. So the Medicaid does several things. One of the things that it does is it covers the difference between what Medicare covers and what the providers charge. So I don't see a bill for that 20%. I don't have to buy a separate policy for that. I actually did buy a separate policy for a couple of years while I was also on Medicaid, and realized I had been throwing away $100 a month. So I stopped doing that. Medicaid covers more things than Medicare does. Medicare does not cover well things like dental care, except in emergencies or when there's some kind of disfigurement. They'll cover some of that, but they won't cover normal checkups. They won't cover fillings or dentures or things like that. And Medicaid does, if you can find a provider that will take that. Glasses. Most optometrists will take, that I've heard of or have seen, will take Medicaid payment for their services up to the point that Medicaid will pay for. And in the last time I got glasses, I needed triple trifocals, and they covered, and Medicaid covered the basic lenses and the basic frames. These guys are quite nice, but basic. So they covered that, including the grinding 3 different prescriptions into the lenses. For dental, back to dental, Medicaid covers, as I said, the basics. I got These teeth are Medicaid teeth. They will cover the basic, the basic level of dentures, and they won't cover implants or, things like that. They'll cover certain amounts of, certain types of, I don't know if it would be caps or crowns that might be necessary. That covers some oral surgeries, things like that. And that's almost completely covered. There is a very small copay for the probably 6 or 7 visits I made to the dentist to get my dentures fitted and adjusted. That cost me, I think, $2. So that's a reasonably good.
That's a good deal.
That's a good deal. Yeah. I would prefer not to be disabled to have to get that, but there you go.
Yeah.
So in my particular case with Medicaid and Medicare together, I have essentially a single payer system where I don't have to think about bills. I said if I need an appointment with the doctor, or if I need a surgery or eye care or dental care, I make the arrangements. I go and the billing is done, and I get gets paid for, and I may get a statement showing what was paid, but I don't get a bill. So I am in a very comfortable situation, and maybe just as well off as the UK or some of the European systems that we've heard about, with the advantage of the American system, in my area at least, having very short wait times and very high service quality.
Right. So, some random geek, your sound is on. So
yes,
Hi,
I'll mute myself. Sorry, we went to a parking garage, so I went into a cave essentially.
Oh, we lost you, or you lost us. One of the two.
Yeah.
Before we go on, I do want to ask. So I want to do 2 more topics, and then we can wrap it up. The 2 topics are, I know Leto had questions about disability programs in other countries, so I wanted her to have a chance to ask people from around the world. And then the way I'd like to wrap up is, I'd like our non-American guests to say your thoughts on how you would fix the American system, and for the American guests to say what parts of what you heard tonight did you think would be the most practical, or things that really need to be implemented in the US system. So something for everyone to think about. But yeah, did you want to lead the conversation then, Leto, on the disability issue in different
I mostly
countries?
wanted to talk about how that works in France, because I'm not going to. Okay, focus. Because it affects me. Basically, I have something called spondyloarthritis. It's a chronic inflammation of the joint cartilages. But I have a kind of arthritis that is not ankylosing, so I am lucky because my joints aren't going to be too stiff, but that disqualifies me for disability because I have comorbid fibromyalgia. Does everyone knows what it is? Because I know arthritis is something people know.
Yeah,
but
we would call it fibromyalgia, just an American accent.
Fibromyalgia, okay.
Yeah.
In French, we say fibromyalgie. So it's neuropathic pain. Basically, it often comes with depression and or other chronic pain affections like arthritis. So fibromyalgia is my primary diagnostics. And it's doctors think it's a real illness, but Social Security thinks it's not.
Right. Yeah.
Because we don't know it well yet. And
like Lyme's disease in the States.
Yeah, kind of. In France, we think they think Lyme's disease is a real thing because there's blood work to prove it and stuff like that. There's no such thing with fibromyalgia because it's neuropathic, so we don't know it well yet. So that was just a tangent to explain where I come from. And it means that I don't qualify for disability pension. But obviously, I can't walk because some days I'm perfectly okay. I can walk. I can do basically whatever everyone can do. But some days I can't. Some days I can't even get up from the bed without asking my partner to help me. So obviously, I can't have a job. So it's complicated because you want autonomy, but at the same time, you don't want to be dependent on others. And I don't know. I'm pretty pissed about how it works, to be honest, that pain isn't considered a disability in France. And yeah, I'd like to know how that works in other countries. I know in the UK, it's covered by disability because I have a friend who has fibromyalgia too, who lives in the UK, and she gets a pension for that. So I don't know how that works in Germany, United States, Canada, etc. That matter. So I'm pretty interested in that. So yeah, I'm going to mute myself now.
All right, Mariana, do you have any? If you don't, I mean, it's kind of again with spontaneous question. Do you have any insight on how the system here handles it?
Yes. Just for the Lyme disease thing, there's actual Lyme disease that you get from ticks and that can be fixed with antibiotics. And then there are some people who think antibiotics don't work or you need lots of it and think Lyme disease can become chronic, absent of any bacteria in your bloodstream.
Right. That's actually what I was, the long-term effects of the initial bite, Lyme's disease exposure, and then the follow-up. That was, what was I was comparing. So thank you for adding that info.
Yeah. So in Germany, I have no idea if fibromyalgia is covered or not, but chronic pain in general is. But if you want disability benefits or something, you have to first talk to your doctors so they are prepared and you have up-to-date diagnoses. And then it's a good idea to join one of the social service help vereins, like the VDK. I'm a member of them, or talk to a social worker, because filling out the application is a bit gnarly. It's pages upon pages of stuff that you have to fill out, and yeah. Then you send it into the Versorgungsamt, who will take the application, contact the doctors for your diagnoses. Then they have their own in-house medical service where it's they look at the stuff and they have lists where they see, okay, diagnosis X is percentage of disability Y. And the thing is not cumulative, so they give you the worst one. And the whole process takes months. I applied in May and I got the answer in September. And they gave me 30%. So, but if you have this, if you are employed, you can get certain benefits. You get tax benefits, but if you can't work, the job center has to evaluate you, and the pension center has to evaluate you. So if the job center medical service of the job center says he can only work 2 hours a day, they send you on to the pension services, and they evaluate you to see if you actually qualify to get disability pension. And very often it is the case that the job center says he can't work, and the pension services say, no, he can work. And in which case it is also a good thing to have a to join things like the VDK, because getting that sorted out is hell, I've been told. So in the meantime, it's sometimes people don't. The job center says he can't work, so we don't pay unemployment. But the pension services say he can't work, so we don't pay him a pension. And in the meantime, you're standing there and have no money. So yeah, and then there's fun things like the job center sending a paraplegic person for a job interview at a roofing firm where he had to climb up to the roof or things like that.
That actually happened?
Yes, that actually happened in Munich. More than
Being
once.
disabled is so much fun. I swear.
Yes, I know.
Marius, do you know how the system, it sounds like it would probably be pretty dire in Poland based on the way that they push people into the private system, but did you want to speak to the specifics, if you have any knowledge?
At least for disabled people, we have a rent system. It's called renta. It's if you're disabled, you get basically paid and you get free health insurance. So the problem is with people who are seriously disabled, who need basically assistance. And people who provide this assistance, mostly those are parents or spouses or family. They have to work 24/7 to take care of their disabled loved ones, and they can't work. And the government basically turned their backs on them a while ago, and recently it's become even worse. So it's like about €100 a month for taking care of a person who can't even live without assistance.
It's a really dire situation that people are in.
Polish healthcare system is okay when you're not seriously sick. If something happens, you have to count on doctors who they basically work the system to help you, but not everyone does, and it's sometimes very difficult.
Right. Tim, thank you for that. Was there anything else you wanted to add? Was it okay? Yeah.
No.
Okay. All right. Thanks. Yeah, Tim. How about you? Sounds like your mom had. I don't know if she was disabled enough to be off of work with her knees.
Oh yeah, she was. although she didn't want to be, of course, because she likes her job, and she's only had it for about a year now. But I say for about 3 months, it took her to recover fully. You're really stiff after an operation like that, so you have to like exercise, and it's very painful, and you can't walk without a cane. Actually, at first you can't walk at all, but then you have a cane for a while, and then eventually you get back normal, and she's pain-free now after all that suffering. So that was good. I was actually trying to look quickly to find if what's covered under the Canada Health Act for disability, and I keep coming across the phrase. I keep coming across the phrase things that are covered if they are medically necessary. So I would take that to mean that if you need glasses, if you need a wheelchair, a cane, brace, anything like that for your well-being, it's covered under that definition. I would take that to be true. So that's good for people that are disabled. I know that a lot of people that have disability of some sort, they can't work, they get a stipend of some sort every month. Either a workman's comp or just welfare or something like that. I forget the exact definition of it, but that varies from province to province, of course, and I believe there is some federal money as well kicked in. There's a lot of federal and provincial money in a lot of things in our country. It's kind of hard to see where the line. It's very blurry, where all that money comes from. So I think people are overall happy with what if you're a disabled person gets in Canada. It's pretty well taken care of. And what was the second question about the U.S. or we haven't gotten to that yet?
Yeah, we haven't gotten to that yet. That'll be like the closing bit out. So yeah, we're just focusing on the disability side now. So that's great.
Oh, okay. I guess in summation, things are pretty well taken care of if you're disabled in Canada. I have a disability actually myself. I learned disability, and when I was a child, I had therapy for that, and that was covered. And there was assessment done on me by a psychologist, so I can get exam accommodations all throughout high school and university, which helped a lot. And actually, when you're trying to get a job with the federal public service, they ask you one of 4 questions. Are you a visible minority, a woman, or a First Nations? And also, are you a person with a disability? So I fit into that last category. Not the other 3, obviously. So it does help you get a job as well sometimes.
Good to know. Does anyone from the States have any experience with disabilities? Oh, Tom, you did, right? For a couple of years ago, though, now?
Yeah. My disability is chronic major depression, so I don't know what the physical, what the accommodations or what the situation would be like for a physical disability. So I can't really speak to that. My mental health care is all covered, and that's allowed me to live as well as I could live. I'm doing okay. I would hate to think what would happen if I weren't able to get my medication or my counseling, but the way things are, it's covered pretty well. For me, again, on Medicaid and Medicare, I can only imagine, although actually I can more than imagine because I've read way too many news articles and analyses of people who are in a situation to who are in a situation where they have no ability to get the help that they need, or they can afford it for a while, or they can afford it, or they can go through a public system, county or state system that has long wait times, and even for things that I would consider emergency care, sometimes the wait times are pretty long for that. And there are of course, holes in the system, especially in rural areas and in some urban areas where there just aren't providers within reasonable striking distance. So I guess that's I can't speak to. I didn't do the prep for
No, it's fine. It's fine.
overall.
Absolutely fine. Everyone's been great.
This is pretty much my experience, and my experience has been after a real horrendous beginning. The grilling that I went through to get a disability in the first place was long and arduous, and I was denied the first time, and I had to go through a professional to assist me with the second application for disability from the federal government. But since it's gone through, I've been in pretty good situation. So I think what that says to me is that when the government decides to get off their ass and do something for people that that they say need help, they can do it pretty well. And with with not a very with a very, very short hierarchical chain of paperwork.
Well, that's good to, it gives people hope for, like an improvement to the U.S. system where, you can get the help you need, the healthcare you need. And
we can do it. And the healthcare in this country, I was looking at a comparison of healthcare between us and advanced countries in Europe and Japan. And the outcomes for us were generally on the low end, if not the bottom. The wait times were a little better than most places, but there are better places than us. And the costs were something like twice the amount of the second most costly country in that list. And if I remember correctly, the UK has the highest outcome. Has the best outcome of all the advanced nations in the world for healthcare with their healthcare national health system, national health service. So I think to the question of whether we can do it, hell yeah, we can do it. Hell, we're Americans. We can do shit. The problem is we're also Americans in a system that is now corrupt and pay for play, and the people that have the money are the ones that benefit from the insurance companies and the medical supply companies and the pharmaceutical companies are the ones that benefit, and they are the ones that buy the Congress and state legislatures. So it's the will and the system and the corrupt system that's keeping us from doing it. I don't think there's anything that another country we've talked about today has done that is positive that we couldn't do if we decided to cut through all the bullshit and go for it.
Yeah. So to wrap up, if I could go and ask that question, I'll start with my European supporters first. We'll go in the order that everyone presented. So Mariana, from your German perspective, what fixes would you make to the American system?
Well, get rid of private healthcare and do a single payer, and cut the defense budget and put it into healthcare and education while we're at it.
Seems sensible. Leto, is there anything particular that you think from your French perspective that the United States really needs to focus on or could do much better?
Yeah, I don't think any system is perfect, but pay or die is not reasonable. Let's be honest. Basic needs should be covered, and I don't know. The system we have in France, while not perfect, exists, has been here for at least 70 years. It works not too bad. Give it a try. Give it a try.
All right, thanks for that.
Also, just a thing that I wanted to say, because earlier Tom was talking about the prices of medicine in the US.
Yes.
An anecdote that I like to tell is I have a contraception implant in my arm that is made in the US. And in France, it costs 160 euros. 70% of it is paid for by Social Security, 30% of it by my personal insurance. In the US, it costs between $600 and $1,200, I think. So
that's crazy.
It can cost 10 times more, even though it's made in the US. The government needs to have a say in the prices medical industries do, because I remember the thing with the guy who bought the AIDS medicine and jacked up the price. Nobody should be able to do that. It's not. People's lives are at stake here. So
when you have a private
at
market,
least regulate it a little. If you don't want to go all the way to single payer, at least regulate a little the industry, because you can't do that. It's not. I don't know. It's not ethical in my opinion.
Right. Thanks.
And I'm talking. I stopped talking now.
Yes, so Mary-Louise, it sounds like the situation in Poland, obviously it's quite easy for the Germans and the French to sit feeling quite superior on this topic over their American counterparts, because they are. But your challenges are far greater actually than what people face in the US. And it doesn't sound like the government that you have right now is really going to be investing much in the people who need the services to get the waiting list times down and to services. So, I mean, is there what are the parties that are active, if you know, like what are some of the solutions? You talked about the hunger strikes. Obviously, the residents need to get paid more. They need to work less. Are there other practical things that could be done that you think that would make a difference?
Basically, managing the system, taking care of it all the time, adjusting what needs to be adjusted. That wasn't done. Nobody really took care of it, and there were multiple forays into privatizing it, and that's the problem. And as we still have a right-wing government, even more so than the previous ones, I don't see any chance of getting better.
I mean, in the right-wing government. I'm sorry.
Also,
you finish.
They've been cutting spending for healthcare all the time. So, if you cut spending for healthcare, that's what you get.
Yeah. I mean, when you say right wing, there was recently, I think in the last year or 6 months, they tried to make abortion completely illegal. And
that was a while ago, and that wasn't actually the government. That was something called Ordo Iuris. That was a fundamentalist Catholic group with ties to the Dominionist in the US. So.
Oh, right. Okay. Yeah. Those guys are scary.
And it passed into the parliament, and then the protest blew up, so they had to scrap it. And now they're trying to do something around this, something of the kind. Propaganda is they're trying to get rid of eugenic abortion. So basically, when there's some disabilities or damage to the fetus, something like that. So next step.
Right, because they keep chipping away, keep working.
Yes, that's their plan.
Yeah. That's depressing. I'm really sorry.
No, we have to live with it. At least we don't have Trump.
The whole world has that now. At least we don't have Trump. That's true. That's very true. Tim, how about you? Your thoughts on this?
So this is something I've given a lot of thought to, actually, for several reasons. I have quite a lot of American family as well, because my grandmother, she had two husbands. One was Canadian, which is my dad's father. Then he died really young, and then she married an American. And then so we had a whole bunch of half American uncles and aunts and cousins, and down in Maine mostly. So I like them to have a free healthcare system like we do up here, or some kind of system like that. It doesn't have to be single payer necessarily. Like I said, there's other alternatives to single payer. I think people focus on that too much in the States, like Bernie Sanders, and he there was an article written on the CBC this week by a guy, a doctor, who's like the chief resident of one of the hospitals here, saying that Bernie focuses too much on Canada and on the positives, but not the the deficiencies with like the wait times, for instance. So we have problems too. I guess is what I would tell everybody. But I watch a lot of like shows like the Young Turks and The Majority Report with Sam Cedar, who discuss this a lot, especially on Sam Cedar's show. So I guess what I would probably advise is the best strategy would probably build from like what New York and California are doing right now, which is they're trying to set up their own systems, and those are two of the big blue states. Actually, like the two biggest blue states. And I think a lot of Democrats at the state level see that a national health system is probably not going to happen, just because Congress is so corrupt, and just in the pocket of the American Medical Association, similar to like how I kind of equate the healthcare to the gun control debate. It's the same kind of situation. There's a powerful a lobby group backed by the large manufacturers, pharmaceutical or firearm as well. So it's hard to break through that. So I find at the state level it's probably more achievable. So each state should probably look to see if they can set up their own universal healthcare system, and then maybe eventually the federal funding will be put into it as well, just like how Medicaid and Medicare gets federal funding as well. Which I guess those are federal programs after all. So there should be federal money in them. I guess I would say it has been tried before. Bill Clinton tried. Hillary tried back in the early '90s. It didn't go so well. So people like
Gingrich.
Yeah, Dick Armey. Sorry.
Oh yeah, those guys.
See, I kind of black out Newt Gingrich because he's such a disgusting human being. Because he left his wife with cancer, and he's a serial philanderer, and we won't get into that. But I don't know if everybody's ever watched Michael Moore's movie Sicko about this. Kind of goes into the history of it, of how the HMO system, the current system in the U.S. was set up, and you can blame two people for it. Basically, Richard Nixon and I believe his name was his last name was Kaiser. I think it's his first name I can't remember now. I think it's Edward Kaiser, who's the guy that founded Kaiser Permanente, which is one of the biggest HMOs in the U.S. right now. Which maybe some of you guys have health insurance too, or not, perhaps. But they are the ones that caused this mess. And I'm not sure how we can fix it. I think you just go through the states. That's the best way to do it, probably. And I guess that's all I have to say about that.
Okay, great. So Matthew, what about what you heard tonight sounds really attractive to you? I think I know, but
what sounds attractive to me is simplicity. Right now, the U.S. Anyone who calls, I know I mentioned this before, anyone who calls the U.S. healthcare system a system is insulting systems everywhere. Because it's not a system; it's just a hodgepodge. Because you can't sell healthcare across state lines. So every state has their own rules, and so every provider in every state does something a little bit different. So now you've got hundreds of different systems that it's hard from one person to the next to know what's going on. So it's the simplicity of having, even what Tim said, with every province having their own system is much simpler than what we have here in the U.S. And of course, U.S. now has this problem, this idea of the rugged individualist trying to dismantle what we already have in place, and Congress trying to do that seemingly every week. So it's just an insane idea. I'm protected. I'm mostly happy at the moment, but I know lots of other people are struggling.
Yeah. Hey, some random geek, you still with us? Because you look a bit frozen.
Yeah, I'm still with you guys. I just like the people invade my what to do with the costume?
Okay,
Holy
that's
fucking shit! Say exterminate!
Sorry about that. I don't know what to do to fix the audio.
well, that's okay. I think we might just have to give you a pass because it's literally almost indecipherable. Decipherable. It's so bad it's making me stumble over my words trying to reconstruct the noise in my mind. Sorry. So maybe we'll just have to wait till you get to a better spot, or maybe that won't. I don't think that's going to work. So Tom, do you want to give your thoughts and then I'll give mine and we'll wrap it up?
Yeah. I am attracted to the idea of a Canadian style, a single payer, but I take what you're saying, Tim, on board that that might not be the best or the most achievable system. But I think in Bernie's defense, to be controversial, I suppose, a little bit here, you sometimes have to ask for more than you want, and then try to settle for something workable, but not that. So I think if we can be looking at the systems that pay mostly from one single pot, and then work backward from there to something that covers everybody, fully adequately, and covers people in a timely manner, would be ahead of where we are now and probably cost a lot less. I think the idea of the states being the laboratory of democracy comes in when you're talking about New York and California trying their own systems and see how that works. And if that works all right, other states might want to pick it up if we can get rid of some of the boneheaded right-wingers that are running so much of the show at this point. I think Wisconsin 10 or 15 years ago might have been one of those laboratories, but now it's not now because of the political situation. Again, corruption coming in. I think the ideal would be some merging of public and private, because I don't think we're in a situation where we could ever or not for some significant period of time dump a significant private element to the healthcare system, to the health funding system. But I think from what I'm hearing from all the other systems, even the Polish system at least recognizes the need to cover everybody. If we can just get to the situation where we say to ourselves as a nation, where everybody gets covered for basic care somehow, and nobody goes broke because of health. I think if we start with things like that, with sort of a basic baseline understanding of that's what we need, bottom line, we can back and fill a system that will build that. Again, my personal preference would be for a NHS style or a Canadian Medicare style system, but the mixed systems that we've heard talk about in France and Germany sound like they are doing the job there too. I think I'm confused. I'm maybe confusing. I'm certainly confused, and I think that's because the healthcare system I live in is fantastically confused and confusing. And
I don't think you sound confused at all, Tom.
well,
Not at all.
then the system that we have, as Matthew said, is not a system. It's probably as confused as I'm feeling right now. Whether or not I sound confused. So anyway, done.
Sounds good. Hey, Jonathan, do you want to try again? Because your visuals are coming through better now. So.
Okay, well, I'm also kind of at the convention, so there's going to be some background noise. Do I sound better?
You sound so much better, and the background noise isn't bad at all.
Okay, so, yeah, my thoughts on the healthcare system is like that. I agree with like the other points that have been brought up. Keep it simple, or like it's not a system, it's a collage, a conjunction, or a Rupert gold machine of like different things that like, but yet Rupert gold machines work. But I think I'm just going to go with like point to people to Peter Coffin's very important documentaries at number 5 that the USA needs a single-payer healthcare system, because part of the reason also that Peter Coffin mentions why we have the healthcare system now was like back in the 40s because of lobbyists. But also what changed. But yeah, what Tim said is correct. That like we can also blame like Richard Nixon and others for like giving Americans the choice to choose their own doctor, the power of choice and all, and that's how we got the private system that we have. And yeah, and I guess it's people's choice to die because they can't afford it, but that's insane. Yeah, we need single-payer healthcare system, so that's what I'll say.
All right, good. I'm glad I felt bad that we couldn't hear you before, so I'm glad we got you in before the end of the show. Well, I'll wrap up by giving my thoughts. I've mostly been conducting the hangout and not really speaking that much. Sometimes I talk too much, but my thoughts on this are that I very much appreciated the NHS when I was in the UK, and I used the services while I was there. I paid my taxes, so I felt like I was putting in, taking out. And since I've been in Germany, I have to say I have had better sort of. It's not that like the healthcare quality is different. It's more about the fact that I think there's more of a customer service element in the German system. And I know that a lot of my American friends are very happy for single payer. And I do think when we talked about the difference between universal healthcare and how that can take shape in the United States, I think that given the structures of insurance companies that already exist, and given the fact that I'm a federalist, therefore I don't want to have the same fight 50 times. I'd rather just take it to Congress and have the fight once and then make everybody do the same thing, because it's one country and everyone should be treated the same regardless of where they live. But I actually think that the structure, given that the insurance companies already exist, could probably be adapted easier than switching over to a more NHS style, UK straight, sort of no fee at the point of service. You just go and make an appointment. The important role that I think the insurance companies do play is that they do moderate the administrative element of healthcare, because one of the, we talked earlier about doctors don't want to spend their time sending bills to people. They want to get on with doctoring, and that's a fair point. But when you have, I think the German system, you have a standard level of care. You have companies that kind of cater to different demographics or try to provide different emphases or whatever else. But at least you have a standard of care that you can depend on, and then go from there and make more choices. Like, I don't need a lot of stuff with, I kind of looked a bit at the insurance stuff, and eventually I just randomly just poked one out because they were so similar. But some of them cater more to people with kids, and some people are, more toward people who are getting on with retirement. At least that was how the literature looked to me. And so I found it just sort of basic, hey, I'm a single woman without kids, I don't really care plan. And at least then I had some kind of choice in the process, and I have a company that I can talk to about things, and I don't always have to go through the administrative elements of the hospitals. So I think that even though it might sound very illiberal of me, perhaps, I think an easier step for America to make would be if Congress were to regulate the price of operations nationwide. And insofar as, things cost different. Maybe New York is more expensive than a rural area in Tennessee, but they should be about the same. An operation shouldn't cost different amounts, certainly not depending on who your insurance provider is. If you have an MRI right now, if you've got a big corporate insurance company that your company has hired, they get a discount rate because they have so many clients or they have so many patients and customers, whereas a smaller insurance company pays more for the same MRI technique, because that's how hospitals kind of play the system in order to make more money. And this is the kind of stuff that Congress could really step into and make the market less profit driven. And I do think in that way I'm far more of a social democrat, in that I think that there needs to be a sort of a mix, again, like the German system, where you have a mix of private and public, a basic level of service, but then you also have enough regulation to keep the market afloat without people being gouged or in other ways. And that would be the hard part, getting it through Congress, because of the lobbyist problem that Tom pointed out. But if I'm not practical, if I don't think about the way that lobbyists would try to undermine the system in their myriad of ways, then I think that step first to a public-private mix would be an easier step than trying to flip over to a more NHS style. And since now I'm repeating the point that I was beginning the thought out with, I think that brings me to the end of my thoughts. So I will just look around the room a little bit and see if there's anybody who has any point that they wanted to raise before we sign off for the night, or anything you wanted to say. Yeah, go ahead.
Yeah. Did we mention about like the Affordable Care Act and how that made significant changes to the American healthcare system and improved it, something like that? Because I want to bring that up.
Yeah, go ahead. I don't know about that because I don't live in the States, so I need somebody who has more direct experience.
Well, I can tell you from like watching a lot of healthcare triage and of course the news. Okay, the biggest things that the Affordable Care Act did that was a significant change, and like we should keep that, is that before with the HMOs and the previous healthcare system, you could be denied coverage because of a pre-existing condition. What is a pre-existing condition? That was vague, nebulous, and never really defined, and it could mean differently depending on the states you're in or the providers, maybe, something like that. But that was kind of like the number one thing that caused people to be denied coverage. In fact, one story that was featured on like Last Week Tonight when they covered healthcare, there was a baby that was denied coverage because it was too fat, and so because of pre-existing conditions. The Affordable Health Care Act and Obamacare fixed that by getting rid of that, so it kind of did force insurances to provide coverage for people that normally would not have been provided coverage and stuff like that. So that's one good thing that the Affordable Health Care Act did.
Excellent. And to build on that point, I would also add that this is why I get bristly when Republicans talk about their solutions to the cost of healthcare. Their solution to the cost of healthcare is to sell people basically like crisis insurance, like if you have a heart attack or something terrible happens. Catastrophic, I don't know if that's the right term, but basically it covers almost nothing. And it costs very little because it covers almost nothing except really terrible things. The problem with that is, imagine that's their solution to the problem of the cost of healthcare. Imagine if we apply that logic to, say, the cost of an automobile. And Republicans were saying, well, what we really need to do is allow manufacturers to sell cars without seatbelts or airbags or safety glass or fireproof kind of casings, because that would be cheaper and then more people could afford cars. So that's the solution to the problem, is to take away all of the basic safety things that everybody needs and will save everybody money in the long term, versus selling people insurance that doesn't cover something like a chronic illness coming up and then them ending up in the emergency room, which is with a system we had before. So yeah, I just want to throw that out there because I wanted to build on your point, Jonathan, about the way that Democrats, people keep talking about the Democratic Party and it's all in crisis and all this stuff, but it still got policies. It got the Violence Against Women Act through. It had the Clinic Protection Act through. It did the re-up of the Voting Rights Act, which the Republicans haven't been able to do. So for all the complaining about the Democratic Party, and I'm off on a tangent now, it's still the party that is delivered for families and people and an ethical approach to the relationship in terms of the citizenry and the kind of services that when you pay your taxes, you can expect in terms of provision back or protections back. So yeah, thanks. I mean, I'm happy for the Democratic Party for all its flaws, because it's certainly better than the alternative, which I think we all agree on here, because we're in an echo chamber, left-wing echo chamber of evilness. All right, guys. Well, I think then if anyone else has a last point, yeah, I heard someone's mic go off.
Tim said in the chat he has something he wanted to say.
Oh, yes.
Yeah.
Go ahead, Tim. I see you now.
I'll try to make this brief as possible. What I want to say is, that's my dog barking, sorry.
It's so cute.
I think healthcare should be viewed as a human right that everybody should have access to. That's sort of the ideology that we should be working off. Now, with a healthcare system that is that's run by the public sphere, so the private sphere, there's a motive to help people and not to try to increase care. Because a lot of the HMOs try to actually get people to push or when I say people, I mean the doctors and the nurses, to push more healthcare to kind of like so they can make more money off the insurance. Now, in a system like Canada, we do preventive medicine, where we give as little care as needed and try to prevent people from getting sick further down the line. So that also helps to cut the healthcare costs, which is why I think you'll find in the U.S. the healthcare cost per person is higher than in these other countries that we spoke about today. Like, for instance, like in Cuba, they spend less per person than on the U.S. because they have a public system and they do, the kind of medicine where they try to prevent people from getting sick further down the line, So consequently, people also live longer in these countries too. For example, in Canada, I think it's 3 or 4 years for men and women that we live longer than Americans do. And it's probably more in the European countries as well. I have experience with the Norwegian system, which we didn't talk about today because there's no one from Norway here, unfortunately. But that system is very comprehensive. It's the most comprehensive one I've ever seen in the entire world, to the point where it was actually cut out from Michael Moore's movie, Sicko. I think it's an extra on a DVD, but he cut that part out from the actual release because it was so, the amount of care they get is so beyond understanding for a lot of people that it just, which made people too mad, he thought, so he cut it out. So it's really that great in Norway. Just as a final thought. So that's all I wanted to say.
Yeah, that's good to know. Thanks for that.
Yeah, in a way, the U.S. always felt that healthcare was a basic human right, because the fact that, like, if you, even before in the system before, if you go to the emergency room, they cannot deny you coverage and that cannot deny you access. They will treat you if you have a bullet wound or a knife wound or something like that. They will treat you, take out the bullet, patch you up, and make sure that you're good to be cleared to go back. Oh, there's a cute puppy. So it is basically human right, but the problem was with this before, and in a way, it's kind of now it's just that you foot the bill. And if you didn't have insurance, you would foot the entire bill for the emergency room visit for a bullet wound or a head injury and stuff like that. So in America, it is a human right, but
is it a right or is it a lawsuit prevention technique? If you were turned away at the hospital and then the family could sue the hospital because the doctor's Hippocratic oath and they didn't, it might just be basically, yeah, if you're dying, we'll treat you, but you have to be dying.
I think it is
my
a
legal
law.
liabilities. I mean, it's a nice principle. I mean, that's how it kind of works out in practice, but just being cynical and American, I have to wonder if it's more to do with covering their asses in civil court.
I wouldn't put it past lawyers that for being the reason, because what's worse than doctors? I guess lawyers.
Yeah. Anyone else? Oh, Tom's AFK. Yeah, go ahead.
Just a thing, because I think I forgot to say it when I talked about how it works here, but we can choose our doctors and we have no wait time. I'm not sure I made it clear actually, because Tom talked about wait time. If tomorrow I'm sick, I call my doctor, and when she can see me, she sees me. So
Yeah, I
Yeah,
also had very good experience with that in Germany, where I had I made an appointment with a GP. I actually called at like 3:30 and said, "Can I get in for an appointment to see the doctor for a good thing?" And she's like, "Can you be here in an hour?" I'm like, "Yes, I can." So by 4:30, I
yeah.
was in
My
the.
doctor is actually just at the one, not even one block away from where I live, and she's amazing. She's the one who finally diagnosed me, even though 2 years ago, even though I've been in pain for about 10 years. And she's awesome, and I'm very, very happy to have found her. But yeah, we can choose our doctors. There's no wait time. And I wanted to say something else. Yeah, private insurances, they can't refuse anyone if you can pay the fee for the insurance. They cover you. They can't say no, we won't cover you because you have a pre-existing condition or whatever. That's all.
Yeah. Yeah, I got in at 4:30, and that was on a Monday. They made an appointment for me on Wednesday morning, came in first thing 8 o'clock, and they did the tests, and then I got my results on Thursday. It was phenomenal. And it's on my way home, my doctor's. So I literally like walked to the doctor's on my way home. That was wow, this is amazing.
It's so cool to have your doctor next to you.
Yeah.
My physiotherapy center is like 10 minutes from where I live too, and I have physiotherapy twice a week, so I am there quite a lot. So it's my little walk of the week when I can. I wait my 10 minutes to go and my 10 minutes to come back. And
Yeah,
physiotherapy
and that's so when
is valuable.
Yeah. Yes.
I just wanted to clarify, if I can.
Yeah.
When it comes to basic healthcare, general practitioners, there's not much problem, even if you live in a rural neighborhood like I do. We have doctors almost every day in the local small clinic, but everything else, basically, specialists or any specialized healthcare is a problem. And also, we don't have pre-existing conditions and stuff like this. That's at least that much.
Yeah, Europeans very good before when the pre-existing conditions existed and they hadn't heard of them, and you try to describe this and like, what is this concept of a pre-existing condition in your healthcare? What does that mean? But yeah, the other thing that I wanted to say, no, I'm trying to think. No, it's gone. It's gone, I think. It was something to do. I was going to ask Tim something, but now I can't remember what it was. All right. So, any more for any more? All right, going once, going twice, going three times.
Up.
Oh, yeah.
I have a request from Leto. She said that I haven't sworn today. Does she want me to swear?
Yeah. What are you going to drop? What blood or bomb are you going to give us tonight, Tom?
Well, I need to find out if she wants me to do it now or after the
Well, now everybody wants to hear you do it.
Oh fuck! I don't know. Oh. Never mind.
I don't know why, but
bombshell.
hearing Tom swearing makes me so happy, unreasonably so.
Well, I'm going to go do my thing. Now, speaking of being unreasonably happy, my comfort television, my version of television food, comfort food, is Strictly Come Dancing from the BBC. It's the Halloween episode is up. I was halfway through it when we started the chat, so I'm going to go watch that and finish that and enjoy. But yes, if not, otherwise what we can do is just get Tom on as your ringtone, Lido, and then every time your phone rings, it can be Tom going, "Oh, fuck."
I have... Where am I? Here. I have actually a reverse song saying, "Hello, sweetie," as a ringtone, so I don't want to change it.
Okay, all right. Well, maybe as your email alert then or something.
I love Tom, but he's not as awesome as Doctor Who stuff.
Doctor Who is pretty cool. So, all right. Well, on that F word bombshell, thanks to all of my patrons, both for your support and for your time tonight. Thank you for preparing your talks, or in the case of Tim, just speaking completely spontaneously to the structure of healthcare in Canada with literally no notice. And yeah, you guys really make this an interesting chat, and I appreciate it and look forward to it every time. So for those of you, there are 11 people who actually listen to, we were at 12 for a bit, but still 11 people in the chat, or at least watching. I mean, half of them might be in the Hangout watching the chat instead of talking in the Hangout. But anyway, I was closing. That's right. So from my guests, then you guys have been awesome. Wait, I'm going to take two. I'll edit that out. Edit. We'll do it live. No. All right, guys. I've been Kristi. You've been awesome. And goodbye from me, and goodbye from my guests. Everybody say goodbye or wave goodbye.
Bye.
Goodbye. I'm waving like an asshole. Okay.
Bye.